Artificial intelligence is rapidly expanding its role in everything, including healthcare, and millions are embracing AI tools for medical guidance. Fox Business's Geri Willis joins us now live from Memorial Sloan Kettering Hospital in New York City with more. Hi, Geri.
Hi, Lydia. That's right. What if the most powerful technology in the world could be used to detect the most common cancer? That's what's happening here at Memorial Sloan Kettering, where doctors are using AI to detect skin cancer. Listen.
I think AI is going to be a game changer for skin cancer detection in particular. I think the biggest thing that we need to do right now is test the technologies in their intended use setting so that we know how big a game changer they're going to actually be.
Already, AI is being used to make sense of the data from body scans. This 360 total photography machine uses 92 cameras to spot lesions, producing high-res pictures that doctors interpret using AI. And AI now powers an app to replace a handheld scanning device that doctors use to zoom in on problem areas. A light-powered microscope can see below the skin's surface, giving around 80% accuracy in detecting melanoma. That's the most serious skin cancer and a diagnosis that some 105,000 people get every year. MSK executives have teamed with ChatGPT, but not exclusively, and the company sees a wide range of uses for AI, like speeding up clinical trials, freeing up physicians from time-consuming paperwork, and automating back-office tasks like supply chain management. Listen.
I don't know that we can ever walk back to a pre-ChatGPT era, but now that it's here, and this pilot is one concrete step in this direction, how do we make sure that it's used responsibly?
Already, 40 million Americans are using ChatGPT every single day to check in on their health. And I have to say, as somebody who has been through cancer, the more people on my team, I believe, the better, even if it's an app. The doctors here say, if you're facing some kind of life-threatening disease, clearly, you also need the human doctors. Back to you.
Yeah, we're just expanding the team and the resources available to help us treat and detect. Geri, thank you very much for that insightful report. Great to see you, Geri.
Thank you.
Brian, I think this is very encouraging here. You know, New York City, I always think of it as the best of the best when it comes to medical professionals and options for treatment and care. Yeah. And it feels like the adoption of artificial intelligence, especially as Geri just highlighted, skin cancer, really a step in the right direction.
I mean, it's totally amazing how they can just use a handheld device to figure out, what did she say, like a depth of 80% below skin level? I mean, we've got cancer survivors on this panel. I'm not one of them, but you know, every once in a while I do look down and think, I got to get that thing checked out.
You should.
And like, this is an easy way to do it, Charlie.
I know a little bit about the prostate side, and people are, doctors are using it left and right on prostate and essentially because you want to get into a little bit of prostate cancer, you know, you try to not take it out. Okay, there's a lot of problems when you take out your prostate. So what you do is you try to see if you can figure out exactly where it is. Is it spread? But if it's contained, there are treatments you can use so you can kind of live a much more healthier life. And that's what I did, because they were able to image it and AI it, and they found that my stuff was in a very, very small part. By the way, it got through the MRI.
Really, but didn't get through the next layer of...
There was an AI component which said I had a 35% chance of having it. It was something called the 4K test, which involves AI and a lot of other metrics.
That's fascinating.
And then biopsy found it.
Yeah, interesting.
You know, as we're talking about AI and health, Jackie, too, I mean, we should maybe mention that there is a big strike happening here in New York City among nurses. And one of the issues that they are concerned about is AI. So in this particular story, we're not talking about AI replacing anybody. Geri even mentioned this is AI along with doctors to treat patients. But in some industries, for the nurses here, they are demanding job security as AI is being rolled out. They clearly are concerned about losing jobs.
Right. I think when it comes, for example, to monitoring and maybe some of their duties, they feel a little bit more exposed than the doctors do. But every doctor I've spoken to, including my team of surgeons on the breast side, but also I've shared with you guys, I'm turning 45, I'm going for my first colonoscopy, and that doctor is talking to me about the way they use AI to enhance their screening tools so that if anybody misses anything to the naked eye, you've got this component that is backing you up. And when you finish the procedure, he said, it just makes them feel so much better about the work that they've done. So medical and this industry is one of the places where I just feel so positive about what AI is doing. Anything that can be done to monitor, screen, do better, save lives is fantastic in my book.
I love it. Change is coming. Get on board. Learn how to use it. You will not lose your job to AI. You will lose your job if you do not know how to use AI. We're looking at you, doctors and nurses, figure it out. So excited about the changes this can do in the medical field.
Well said. All right, Charlie Gasparino, always a joy. Thank you so much for being with us for the entire hour. I do absolutely.
Joy with a
sincerely,
capital J.
from the bottom of my heart, Charlie.
Quotes in air quotes.
Coming